Welcome to our HIPAA and HITECH training for 2024. Today we'll cover the essential rules and regulations that govern the protection of patient information, including the Health Insurance Portability and Accountability Act, HIPAA, and the Health Information Technology for Economic and Clinical Health Act, HITECH. This training is critical for ensuring compliance and safeguarding patient privacy. Let's get started. HIPAA, or the Health Insurance Portability and Accountability Act, was enacted in 1996 to address the growing need for patient privacy and data security in healthcare. Its primary goals are to protect sensitive health information, streamline healthcare processes, and reduce fraud and abuse. HIPAA is the foundation of patient privacy laws in the U.S., and compliance is mandatory for all healthcare organizations. Protected health information, or PHI, refers to any information that can identify a patient and relates to their health, treatment, or payment for healthcare services. This includes names, addresses, medical records, and even spoken conversations about a patient's care. PHI can exist in electronic, paper, or oral form, and it's our responsibility to protect it in all formats. The HIPAA Privacy Rule establishes guidelines for how PHI can be used and disclosed. It also gives patients important rights, such as the ability to access their health records, request corrections, and receive a notice of privacy practice. As healthcare professionals, we must ensure that PHI is only shared when necessary and with proper authorization. The HIPAA Security Rule is specifically designed to protect electronic PHI or ePHI. It requires healthcare organizations to implement 3 types of safeguards: administrative, such as policies and training; physical, like secure facilities and equipment; and technical, including encryption and access controls. These safeguards work together to ensure the confidentiality, integrity, and availability of ePHI. The Breach Notification Rule requires healthcare organizations to notify affected individuals, the Department of Health and Human Services, and in some cases, the media if a breach involving PHI occurs. Timely reporting is essential, as delays can result in additional penalties and harm to patients. This rule ensures transparency and accountability in the event of a data breach. Non-compliance with HIPAA and HITECH can result in severe penalties, including civil fines of up to $25,000 per violation and criminal penalties of up to $250,000 and imprisonment. HITECH introduced even stricter penalties for willful neglect. Beyond financial consequences, non-compliance can damage your organization's reputation and erode patient trust. To ensure compliance with HIPAA and HITECH, it's important to follow best practices, such as providing regular employee training, using strong passwords and encryption, and limiting access to PHI on a need-to-know basis. Additionally, potential breaches should be reported immediately, and regular risk assessments should be conducted to identify and address vulnerabilities. In conclusion, HIPAA and HITECH are essential for protecting patient privacy and ensuring data security in healthcare. Compliance is not just a legal requirement, it's a responsibility we all share to maintain trust and provide quality care. If you have any questions or need clarification on anything we've covered, please reach out to the Compliance and Privacy Officer for Mountain Pacific. Thank you for your attention.